Hi, I am Dr. Jayanti Kamat. I am a IVF consultant, obstetrician and gynecologist practicing for the last 20 years at Srishti Fertility Care Center and Women's Clinic. Today I will be talking about vaginal discharge. Now, vaginal discharge is a very common complaint. Women of all ages complain of vaginal discharge. So, what exactly is it? Sometimes it is loosely termed as Leucorrhea also. Now, the complaint of discharge depends very much on the ideas, observation power and fastidiousness of individual women. Now, is vaginal discharge normal or abnormal? Should there be vaginal discharge at all? So, scientifically, the private parts, that is the vulva and vagina, are normally moist to some extent, and this makes the woman comfortable. Usually it does not stain the underclothing. But there are certain conditions in which the vaginal discharge is increased due to hormonal imbalance. So, what are those conditions? That is, at the time of ovulation, the discharge suddenly becomes watery. A few days before menses, it may also become thick. Then it becomes thick during pregnancy, after sexual intercourse, and excessive discharge is seen in young girls just before they start their first menstrual period and a few years after they start their first menstrual period. It is also increased in women who take oral contraceptives or birth control pills. A word about regular douching. Some women are under the misconception that regular douching improves genital hygiene. However, washing away of natural discharge encourages the cervix to produce more discharge. Women magazines sometimes they advocate deodorant products to be sprayed on the private parts and vagina and vulva to promote sexual attractiveness. But on the contrary, the chemicals which are present in this deodorant sprays, they irritate the skin, and douching washes away all the protective lactobacilli, alters the pH, and there are more chances of the women getting infection. Now, what is abnormal discharge? So, when can we say that the discharge is abnormal? If the discharge is accompanied with itching or redness, it causes a lot of irritation, unpleasant odor or smell, burning sensation during urination, whether the color of the discharge, if it is curd like or yellow or yellowish green, and if it is associated with pain during intercourse or dyspareunia. Now, what are the causes of this abnormal discharge? Lot of women ask me, why do I get this discharge? I keep myself so clean. So, some of the causes are, one, of course, it is poor hygiene, then sexual intercourse with an infected partner, public toilets, repeated use of public toilets, then douching, as I have already mentioned. Once you start destroying the natural barrier of the vagina, the woman will be more prone to infection, and cancer, that we should never forget. Cancer or cancerous growths also give rise to discharge. So, if the discharge is blood stained, you have to be careful. Now, why should we pay so much attention to vaginal discharge? Because if this discharge is not treated, it can lead to complications. So, what are those complications? One is pelvic inflammatory disease called as PID. So, here the uterus, the tubes and the entire reproductive tract gets infected. Then abnormal changes in cervix or mouth of the uterus. Now, these abnormal changes can cause cellular changes, dysplastic changes, and later on lead to cancerous changes. Now, what about abnormal vaginal discharge in pregnant women? Does it affect them? Yes, of course it affects them. It can cause premature rupture of membrane or the rupture of the bag of waters even before the labor pains start or even before delivery. Now, this bag of waters is supposed to be a protective shock absorber for the fetus, and it protects the fetus from external infection. So, when this bag of water ruptures, the fetus will be prone to infection and the pregnancy will be at risk. Then preterm delivery. What is preterm delivery? If the woman delivers before 9 months, obviously she is going to run into complications. Then chorioamnionitis, that is infection of the placenta and the fluid which is surrounding the fetus. Endometriosis, that is infection of the lining of the uterus. Now what is the treatment? First and foremost, self-medication is a strict no-no. Why? You cannot see your neighbor's prescription or your friend's prescription and get yourself treated for vaginal discharge. No, you have to get examined by a gynecologist. She will ascertain the cause for your discharge and treat you accordingly. So how do we treat? We usually give antifungal tablets or antibiotic tablets depending on the cause of the infection. Sometimes the treatment of the partner is also necessary to avoid the ping pong of infection between the partners. Then suppose the woman is suffering from chronic cervicitis or cervical erosion, there are other modalities of treatment such as cryotherapy, laser cautery. Then if a malignancy is discovered, the treatment of malignancy will be something which is very specialized. Now what do you have to do to prevent such type of vaginal infection? First and foremost, routine cleanliness. Always use cotton underwear which can absorb the discharge. Avoid synthetic material, nylon, and avoid douching, as I already mentioned, because douching destroys the normal barrier of the vagina and makes it more prone for infection. You should avoid any type of sprays, deodorant sprays, safe sex practices, and of course general health care and good nutrition which will give you immunity against such diseases. A very important point, do not use very hot water to clean your private parts. Some people feel that if they use hot water, they can clear away the infection very easily. No, and because the vaginal skin and mucosa is very delicate, you can use lukewarm water or the tap water. Similarly, do not use medicated soaps like Dettol or Savlon. You can use a mild soap. The thing here is you have to keep the area dry. So you can just use a soft tissue paper and just pat it dry. You should not rub the private parts because again it can cause excoriation of the skin and make it more prone for infection. So please do keep these tips in mind. Thank you.